This next section is all about improving our sleep. One of the things I want to explain is, what is snoring? Why do we snore? A lot of us mouth snore, especially if you're laying on your back, your jaw drops, your tongue drops open. That air that you breathe through the mouth tends to be 3 times the volume because the air tube is so big, and the back of the soft palate starts to flutter. It sounds like this. So normally what we do in this course, you're going to learn all about taping, different types of tape, but to close your mouth. And that, for the most part, helps with the mouth snoring. Now, why do we nose snore? That sounds more like this. Mouth is closed. Well, when you nose snore, you have to start thinking of snoring more for the airway size. Think of it as an engineer. You know, engineers look at pipes and tubes, then they look at the diameter and the flow. So you can imagine, it's just like when I ride my bicycle to and from work, I wear a mask. If I'm breathing heavy because I'm biking fast, if I breathe, the walls of the mask will collapse into my nose. The same thing happens when too much volume, too much turbulence, too much resistance to air happens in the nose, the walls collapse. So we need to learn how to reduce our breathing throughout the day so that at night when we're ready to go to bed, we're not big breathing trying to do it through our nose. It won't work. The walls will collapse. So that whole section on reduced breathing is for us to practice during the day so our nighttime sleeping, breathing volume is less. We're going to learn all about nasal dilators and tape. Why? Because we want to make sure our noses work the best as they can at night. Even mine, I had a deviated septum. I still wear a nasal dilator. I will tape until I die because I sleep like a baby. And I want you all to experience this because it really is important to get a good night's sleep.